Welcome to today's webinar, Going with the Legislative Children's Caucuses, a Roadmap and Lessons Learned webinar brought to you by NCSL. It is now my pleasure to turn the floor over to Bethany Anderson. Bethany, the floor is yours.
Thank you, and welcome to the webinar today. As you said, my name is Bethany Anderson, and I am with the Early Care and Education Project at the National Conference of State Legislatures, and I'm happy to welcome everyone to the webinar call today. I'm joined by Julie Poppy, also with the Early Care and Education Project. Looking at our registration numbers, it appears that we have approximately 39 states and the District of Columbia on the webinar today. We're pleased with the turnout and know this will be an interesting and informative webinar. The goal of today's call is to explore the concept and structure of legislative children's caucuses among several states, including the expressed interest of legislators and the purposes of these caucuses, ranging from broad education to introducing legislative packages. Today we'll hear from a couple who are currently promoting or who have worked with such bodies in their own state. Before we get too deep into content, I'd like to familiarize you with the webinar platform. At the lower left corner of your screen, you'll see a chat box where you can pose questions at any time during this webinar. In order to build some comfort with the chat feature and also get a better sense of who is on the webinar today, I'd ask that you all type the state you are from in the chat box now. Welcome Oregon, Maine, Colorado, South Carolina, New Jersey, Illinois, great, Kansas, Delaware, Wisconsin, DC. Wonderful. Thank you for participating in that exercise, and again, welcome. At this time, I'm going to hand it over to Julie Poppy.
Thank you, Bethany. We are so excited for today's webinar. NCSL is here to support the work of Legislative Children's Caucuses. We are very thankful to the Alliance for Early Success's support to provide technical assistance to legislators and legislative staff of caucuses. So for all you legislators and legislative staff on the webinar thinking about creating a caucus, look to NCSL for assistance. You will hear more about some of the assistance NCSL can provide and has provided throughout this webinar today. But just to give you a little sense now, NCSL can support the work of existing caucuses by providing background information, the latest research, and connecting you with experts from across the country. And I've had the pleasure of working with some of these caucuses. So again, please look to us. And now I'm going to hand it back over to Bethany.
Thanks, Julie. Legislative Children's Caucuses currently exist in at least 8 states. The longest running caucus is the Keiki Caucus in Hawaii. They were founded in 1994. The newest caucus was established just this year in Maine. As Julie mentioned, NCSL is happy to assist states with the creation of their own children's caucus. I've actually had the pleasure of using NCSL and specifically the Early Care and Education team when I was a legislative staffer in Wisconsin. A quick note about the caucuses we'll talk about today. Children's caucuses are legislative groups. We know many states have commissions, cabinets, and/or councils that also address children's issues, and some of those may have been created by statute. But for the purposes of our conversation today, we limit children's caucuses to those whose membership is legislative. In reviewing children's caucuses nationwide, we see some trends. These groups tend to be bicameral and bipartisan. Some receive support from advocates or the private sector. The organization of the caucuses differ, as do the focus of these groups. Hawaii's caucus is quite unique in that it introduces a package of legislation each year that is crafted by a group of stakeholders. Some caucuses, like those in Delaware and Maine, have a narrow scope and focus on early childhood specifically. We also see some differences when it comes to how caucuses share their information. Colorado and Wisconsin's caucuses have strong web presence, which help us at NCSL follow their activity. Having a web presence is not only a useful way of communicating with your members, it can also provide an archive of sorts for the programming you provide. I'd like to highlight Wisconsin's website and Facebook page. Much of their past programming is available online. Colorado's website also provides interested parties the chance to see the programming schedule with a recap following events. I'm excited for our presenters to tell the story of the children's caucuses in their states, so let me go ahead and introduce them. First, I'd like to introduce Wisconsin State Representative Joan Ballweg. Rep. Ballweg founded the Wisconsin Legislative Children's Caucus in 2015 and has served in the Wisconsin State Assembly since 2005. Her previous experience includes serving as mayor of her hometown of Marksman, Wisconsin, teaching first grade in Memphis, Tennessee, and celebrating 40 years of business with her husband, Tom. Together, they own and operate Ballweg Implement. Welcome, Rep. Ballweg. Joining Rep. Ballweg is Michele Jensen. Michele is the Executive Director of the Wisconsin Child Abuse and Neglect Prevention Board. Michele joined the Prevention Board in 2014 after serving for several years as the Director of the Children's Court Improvement Program through the Wisconsin Supreme Court. Thanks for being with us today, Michele. Our final presenter will be former Colorado State Senator Linda Newell. Serving in the Colorado Senate from 2009 to 2017, Senator Newell has been a champion for children. She founded and co-chaired the Colorado Children's Caucus, along with an extensive list of policy successes designed to help children and youth and families. Senator Newell currently works as a consultant and facilitator, where she continues to work with children, teens, and young adults on mindfulness, compassion, and conflict management. We look forward to hearing from her a little later. I'd now like to give the floor to Representative Ballweg to talk about the creation of the Wisconsin Legislative Children's Caucus.
Well, hello, everybody, and thank you very much, Bethany. This is something that started back in 2011. The executive branch and the legislative branch started to hear more and more about and began awareness regarding adverse childhood experiences, ACEs, and trauma-informed care. And we became very interested in how that affected children's issues. One of the ideas we came up with is just do more research. So in 2014, I actually led a legislative study committee on supporting early brain health development. We had 10 members held 4 or 5 information sessions just to get some of the background on how early brain development actually affects children. And what we found was that the long-term effects of not having good support in the 0 to 3 or 0 to 5 ages really affects children throughout their lives. Their success in school, their interactions with law enforcement specifically. We tried to figure out a way that we could continue not only how we could educate ourselves, but more of the members of the Wisconsin legislature to make sure that we could build support for more monetary support and more support in our budget for early childhood effective programming. And that is where some of the idea of the Children's Caucus formed. I say it formed organically. I happened to be working with one of my Senate partners on how we would do this, and actually used NCSL to get a little background on how Children's Caucuses were formed and how many of them there were around the United States. And just talking to my fellow senator, found out that there were a couple other folks that were actually talking about doing the same thing. So we put our heads together and came up with an initial means of trying to organize the Children's Caucus. It was bipartisan to get started with 2 chairs, and then we intentionally invited 2 members from each of the caucuses from both parties, both houses, so we had a steering committee of 10. That group talked about how we would make this sustainable, not something that just a couple of legislators and their staff would be interested in doing and make it a flash in the pan, but really how would we be able to institutionalize this without stepping on the toes of leadership and standing committees and other committees that were organized through the executive branch, but really try to educate our fellow legislative members. One of the challenges, of course, is even though in Wisconsin we don't have term limits, there is a lot of turnover. So we're constantly seemingly going back to baseline to talk about the importance of early brain development and what trauma-informed care is really about. So in our first go-around in 2014, we went to work trying to figure out what our basis was going to be. And we quickly realized that we needed to do something that would make this sustainable in a way and use partners that would be able to help us administratively as well as programmatically. We had many organizations endorse our idea, but they all wanted to be part of the Children's Caucus, and we didn't want to have one organization or another be the point for what the Children's Caucus was going to be. So we worked through that, and that's when we settled on inviting the Wisconsin Child Abuse and Neglect Prevention Board to take on this role. Happily, they were partners from the very beginning in trying to advocate and support our work, and they put us in their budget so that they could help us administratively. It was very natural because myself and my co-chair, Senator Latza, were both members of the board, so we felt very comfortable in knowing that the kind of work they did and the actual impact that they had around the state. One of the things that we wanted to make sure of was that this wasn't something that was centered in a particular location or district of some of the members. We really wanted to have a state perspective. But then our initial meetings worked at putting together the logo and the web presence, both on website and Facebook, having our legislative staffers do some of that work, not just the prevention board. But what really leaned on the prevention board was for our programming. Our first program in the spring of 2016 was our kickoff meeting. We had over 100 people attend that meeting. We thought it was very successful, not only in bringing in legislators and stakeholders, but also that our Wisconsin Eye, which is actually like our C-SPAN for Wisconsin, that does a lot of our public service broadcasting, came for that particular meeting, taped the entire thing, and actually that's still available on our website. The interesting thing about what we put in that program was that, as one of the presenters mentioned, we really brought a focus on early childhood from several perspectives, both the science of the physical perspective in early brain science, the intervention side. We had a presenter from the School of Social Work, and from the economic side. What is the actual payback for making sure that you have good support for early childhood? And I go back to the original steering committee of this group in helping to put together our mission statement, which is on our website, to cultivate a legislature dedicated to advancing promising, evidence-informed public policy that improves the life of every Wisconsin child. And that's where we really lean on the Wisconsin Child Abuse and Neglect Prevention Board to provide some of that. So I'd like to ask Michele Jensen from the Prevention Board to continue on with her part and the board's part in supporting the caucus and some of the other work that we have done since that initial kickoff meeting in April of 2016.
Thank you, Representative Ballwig, and thank you, Bethany, for inviting us to share this information with everyone today. My name again is Michele Jensen, and I'm with the Child Abuse and Neglect Prevention Board. And as Representative Ballwig mentioned, the Prevention Board does provide staff support to our Children's Caucus. I'll just say a few words about the board itself. In many states, we would be referred to as the Children's Trust Fund. Our legislation that authorizes this group, though, just gave it a different name, but we're the equivalent of that group in many other states. And we're a 20-person board that is created in state statute, governed by 10 public members that are appointed by our governor's office, and then state government officials that are representing the governor's office itself, the Attorney General, our state superintendent of public instruction, and secretaries from 5 different state agencies. In addition, we have 4 legislators that serve on our board. And as Representative Ballwig mentioned, as a member of the board, we had gone through strategic planning and really looked at what our role could be as an advocate and an entity that could help promote effective prevention public policies. And so when there was an opportunity to provide this staffing role, it really did align with our internal structure as well with the board. But one thing we had to make very clear as we went through the process is the scope of the Children's Caucus in Wisconsin is broader than just the role of our organization. So at times there can be overlap and a lot of complementary information, but we really want this to be a broader scope in terms of all ages of youth, whether it's prevention or intervention, early care, what have you. And it's really the leadership, the steering committee, and the membership of the caucus that drives the direction. The role of the prevention board is really to assist with that coordination, provide research findings, options, create processes for the governance of the Children's Caucus. But again, decisions are made by that leadership group and the caucus itself. And then we help, obviously, carry out some of the decisions of the board. So I would just add a little bit more about some of the programming that has occurred in the past with our Wisconsin Legislative Children's Caucus. After that kickoff meeting back in April of 2016, which was very well attended by our stakeholders in the state, we had over 100 people fill up one of our largest hearing rooms, and full attendance by the members who had signed up at that point in time to be members of the caucus. It was a great event, but then we were thinking about how could we kind of build upon that and maybe take a different approach to education for our legislators. And so instead of convening something in the Capitol, we did basically a road show where we went around the state. We went to 5 different locations in different geographical regions, and we really wanted to highlight for legislators in their area that they represent different programs and strategies and different community efforts to strengthen families. So you can find a compilation report of those informational sessions on the website for the Children's Caucus. We highlighted such best practices and evidence-informed practices as the protective factors framework, home visitation, the community response program, which is specific to Wisconsin and also Colorado, where we are looking at providing case management and supports to at-risk families who are referred to the Child Protective Services system, but their case is screened out. And so this community response program helps provide that additional support. Parent education programs that are evidence-based, and on and on. We looked at what was happening locally and with tribal nations as well, and put all that information and did a recap event to present to any legislator who wanted to attend to learn after the fact about what some of the key findings were from those listening sessions. Then just last week, we had another event where the Children's Caucus hosted a meeting where Kids Forward, formerly the Wisconsin Council on Children and Families here in Wisconsin, presented our state's kids count data. So Ken Taylor, who's the executive director of that organization, did a fantastic job of really presenting the data, but framing it in kind of our historical kind of trends here in the state, and really, I think, gave some great information for legislators to think about that could inform future policy decisions. And again, that's listed on the Facebook page and the Children's Caucus website. And one thing that we have learned is, again, as Representative Ballwig mentioned, we want to make sure that there's a unique kind of place for the Children's Caucus here in Wisconsin, that we aren't duplicating efforts. We don't want to be the same as a standing committee or a study committee. We also have a family impact seminar that happens once a year. So it's really thinking about, how can we provide this ongoing research-based, evidence-informed education on an ongoing basis, But we've had to be very clear here in Wisconsin that at this point in time, our Children's Caucus is not a policy-making group. It could evolve into that, but in the beginning, the steering committee was quite clear. We thought our first core mission, the priority, would be to just create a presence that was ongoing and lasting and putting that solid information kind of out there and let other policy-making entities and groups that are already there to shape that formation, have them carry that through. So what we've established now as an ongoing kind of process is a way for our external stakeholders to submit a request to present before the Children's Caucus, and we'll hold 2 to 3 sessions per year where invited speakers then will come in, and again, that decision will be made by the leadership of the caucus and the entire membership of the caucus in terms of who will come in and present, and we have certain criteria that will kind of guide that decision making. And we hope that by doing that in the Capitol, doing it on a regular basis, having something that is focused again on that evidence-based and evidence-informed public policy, we can create a presence and this kind of lasting knowledge about the Children's Caucus here in Wisconsin. Just a couple other quick comments I would make. Just if you're a state considering putting together a Children's Caucus, I think one thing that the Prevention Board was able to do in its long history of over 30 years in the state is, we grant out funding to communities throughout Wisconsin. So when it came time to look for presenters, kind of look for best practices across the state, talk to state level partners in terms of what kinds of information should be brought before the Children's Caucus for their consideration and discussion. There were already networks and relationships that were established, and I think that gave us the ability to kind of pull together some of this programming pretty quickly. I would encourage states that if you're thinking of creating a Children's Caucus, to be very clear about what your mission is and the scope and the role, because if you are not clear about that, you have stakeholders who will be very excited that there's a group doing this work, and they will want to pull you in many different directions, and rightly so. I mean, everyone really wants their issue to advance. But for now, again, for Wisconsin, it has been the issue of making sure that if our focus is education right now, that is what we are doing. We're putting out that information. But again, we're not necessarily advancing any one entity's specific position on anything. I think the other thing that our organization brings to this is the ability to perhaps understand and bridge different organizational cultures. Just from where I said, having worked in the court system, it's necessary to plan very far in advance with court calendars, but the legislature moves very quickly. They like to go fast and quick and convene a meeting, a hearing, and stakeholders are somewhere in the middle in terms of being available to participate, to present. And so I think we've been able to kind of help bridge knowing our target audience, our legislators, of course, but I think the momentum that has helped carry the caucus forward has been the engagement of so many stakeholders. Once they've come and observed and heard this information and wanted to follow up with legislators, I think they're adding to that credibility of the caucus and just awareness of it. So I think that's all the comments, Bethany, I had prepared. If there are any other things you'd like us to address, please let us know.
If you don't mind, I just wanted to emphasize a couple of things that you mentioned, Michelle. One is, again, that we are very intentional that this is going to be information only. We're not going to promote or oppose the legislation of our individual colleagues, because we're trying to build the background. So we didn't want to alienate any individuals. The other thing, the idea in going around the state is that legislators love to know what's in their districts. So we did get legislators who did not sign up for the Children's Caucus to attend those regional meetings because they were going to be meeting their constituents and find out what was happening in their home areas. And then finally that we have now progressed into situation where we have 4 co-chairs. We have a co-chair from each caucus, and our individual staff has taken over some additional administrative responsibilities for the website and communication and those types of things also. So we can make sure that the administrative side of things, that the Wisconsin Child Abuse and Prevention Board does, is focusing on that programming side of things.
That's great. Thank you so much, Michelle and Representative Ballweg. If you'll hang on the line with us, we'll take questions after our next presenter. So at this time, I'd like to hand it over to Senator Newell to talk about the Colorado Children's Caucus.
Great. Thank you so much, both NCSL and Julie and Bethany. Really appreciate the opportunity. I can talk all day long about children's caucuses. Very excited that we still have one in Colorado. So how it got started in Colorado was back in, I think it was 2011, when I was in the Senate. There was a missing gap of energy, education, expertise within the legislative body about child welfare in particular. And so, as many of you know on the phone, many legislators don't even want to know it exists or talk about it, let alone get engaged in that policy and get to know it because it's such a complicated area of law. So I was appointed as chair of a joint select committee on child welfare in I think it was 2011. And then we realized, because of the popularity of that, both from the legislators' interests, but also media attention. We had quite a few child fatalities in Colorado at that time, and there were some gaps in the systems. And so we decided that, a few of us decided it would benefit to do more education of that. So we had all kinds of different caucuses, but I realized there was none that covered the children's issues. So I went to some of my colleagues. We ended up getting 2 co-chairs at that time. I was the founding co-chair, and then one in the House. So we started out in 2012, but over the years, we have purposely expanded that to 4 co-chairs, 2 in each chamber, and 2 in each party's caucus. And that has worked really well, because it's drawn attention, though people are usually the ones who go back to their own caucuses and then educate them about it, unless they have additional members in the caucus as well. So my belief is that you've got to educate before you advocate. And so what we did was just create the Children's Caucus, which basically it was to provide a forum for all members of the Colorado General Assembly to discuss the challenges facing Colorado youth, and to work together to develop policy recommendations to strengthen families and improve the lives of children. And we intended it entirely to be nonpartisan and to give that priority of children in the legislature to discuss issues that were impacting every child in Colorado. So we cover early childhood and child welfare, intersection with mental health, intersection with juvenile justice. So we, over the years, have had quite a few different topics. What we do logistically is we realized we had to attract the legislators somehow there. And just talking about kids was not going to do it. So I found a sponsor, which at that time was the Tennyson Center for Children, which is a resident facility for kids in foster care, therapeutic foster care. And so worked with them for the first year, and after that have been working ever since with the Rocky Mountain Children's Law Center and they are a nonprofit organization that helps with guardians ad litem, as well as support to kids and families with domestic violence and kids in foster care. So those two organizations served as my sponsor, meaning they would bring the food and attract the legislators there with food. And then they in turn, especially the Rocky Mountain Children's Law Center since, has partnered in the private sector with funding with Noble Energy, and they are a Colorado energy company. So they have been actually the fiscal sponsors. Noble Energy have been the fiscal sponsors for the entire time. Rocky Mountain Children's Law Center folks are the ones who basically staff it, meaning that they will help me or our co-chairs in creating the agendas, in gathering the experts and who is going to be speaking. So then we would work on the agenda together. One of the things that we decided early on was we were not going to make any official policy recommendations. So similar to Wisconsin, we didn't want to get into specific legislation. However, what we did do was educate on particular topics that we knew were either coming up or were happening in the session, but not in reference to particular bills. I hope that makes sense. So, for instance, one of the things that we would do every year, and what we did logistically, I should say, is we only meet during legislative session, which is in Colorado between January through May, and we would meet 4 times during the session. And we would schedule those prior to session so that we could get the calendar on the legislators' schedule. And then we would roll out announcements and invites and links to our website, that kind of thing. And that would all happen through the Rocky Mountain Children's Law Center. In Colorado, I should give a caveat there. In Colorado, we do not have year-round paid staff as legislators. We have only a part-time aide during the session. So because of that, we heavily rely on outside nonprofits to help us and volunteers to help us do our work. It's very unfortunate, but it's the way that it is in Colorado. So we really needed an organization who would help us staff the work. So with that, we made this a unique opportunity to educate. Any legislator can show up. They don't have to be an official member, but they can be an official member. So on our website, you'll see just a smattering of legislators who are members, but we would often, in fact, most often, have people just show up interested in a particular topic. So as far as programming goes, well, actually, I should back up. We had not only legislators, but in Colorado, we have sunshine laws, which means that we have to have open meetings. And if you have 2 or more legislators working on anything, talking on anything, we have to have a public and open meeting. So because of that, everything we did was literally in public at the Capitol and in a committee room. In that, though, we would not only have legislators, but in the audience, we would have experts, we would have advocates, we would have citizens, volunteers, that kind of thing. And for the legislators who couldn't attend, then their legislative staffs would attend. As far as programming goes, we would bring in early childhood, child welfare, mental health, juvenile justice, education, actually P through 12 experts sometimes, because we also focused a lot on the ACEs work and the trauma-informed care and the intersections between the education, human services, and juvenile justice arenas. So for our programming, we would bring in experts like the Rocky Mountain Children's Law Center was one. We also in Colorado created a Child Protection Ombudsman Office, and that serves as an independent eye that looks at the child welfare system and what are concerns or complaints that citizens might have about that. So she would come in and often do state of the state kind of presentations on child welfare and what are potential gaps in the systems that we could fix, that kind of thing. We bring in also every year, one of the most popular sessions that we would have would be kids from foster care. And we would bring them in and present just what is it like to be in foster care, what are pros and cons that they've experienced over time in the system. That particular one every year is our most popular one, with questions from the legislators being able to talk specifically to a person who lives with a system as a parent. And so that worked very well. We would bring in experts from Children's Hospital in child abuse, for instance. We would also bring in experts from both the state and the county human services departments, because in Colorado, I believe similar to Wisconsin, we have a county delivered system, state monitored, and so it was important to bring in both the county partners as well as the state. We'd bring in public health, especially when it came to the Healthy Kids Survey and research on suicide prevention and protective factors, that kind of thing. We also, in Colorado, have at Colorado State University in Fort Collins, we have one of the leading experts in research on children's child welfare. And so we would bring them in every year. And then lastly, if you are in a marijuana state, what we ended up doing out of necessity, actually, was, and I've done most of the legislation in Colorado when it comes to marijuana and kids and prevention of the two together. But one of the things that we brought in was experts in drug-endangered children policies and systems and how to protect the kiddos from both the opioids as well as marijuana. And then I'll say lastly, with the transition, so I termed out just at the beginning of this year. I was kind of the glue, and when I left, there was a concern that it would fall apart. So what I did was I recruited, before I left, I recruited a co-chair in each of the chambers, and then since they got the other two. And again, bipartisan, bicameral. And then now what they're doing, I am very close to Rocky Mountain Children's Law Center, who are still staffing it, so they often come to me and ask me, who do you think? What do you think? So I'm still, helping out from the outside. But one of the things that did occur last year that they are changing this year is that they are issuing now a mini RFP basically for presenters because it became surprisingly competitive among the stakeholders who wanted to present. And so now they're going to be doing that with the co-chairs and making sure that they do a fair process for that. It's just a little one-pager, super brief RFP type of thing. And then they are continuing to have Rocky Mountain Children's Author and Noble Energy to sponsor and staff. The only thing, the only not negative, but challenge that I got from the current is that they haven't gotten as much media press this last year. So, knowing that, I think I'll probably try to help with that too. But I hope that helps, and if anybody has any questions, I'm happy to help.
Thank you very much, Senator Knoll. I'd now like to open up the floor to questions. We'll prioritize questions from legislators and legislative staff. You can submit your questions in the chat box at the lower level side of your screen, lower left side. You can see I noted there, post your questions. So while we're waiting for some questions, I want to ask Wisconsin, you mentioned that the benefit of having the Children's Caucus was to issue kind of a base level of education amongst your members. So now that you've had a couple years, do you see any positive effects or any movement based on that education?
I think we are. Our speaker this year did have a task force on foster care, and several of the members that were assigned to that task force had been active in the Children's Caucus, so you could see that some of the information was being built upon, put it that way. But as I said before, we have legislators have so many varied interests. There's quite a bit of turnover, and so we do need to keep working at finding champions that will promote this within their own caucuses. And it was very interesting to hear many of the same things that we actually ended up working toward were similar to what Colorado did. So for anyone who's on this webinar thinking about how to do this, I think you've seen two plans that are very similar and to this point seem successful in building that background information.
Yeah, I would just add quickly, Bethany, that yes, our speakers task force on foster care that was created in the state of Wisconsin used a very similar format to gather information. It had some very similar presenters. So I think it also helped create kind of awareness of where some of the programming is happening around the state. It's just a way to provide repeated information, if you will, to get in front of the legislators multiple times to really kind of keep expanding that knowledge base each time they hear it. So I think there's been success in that. I think the attendance at the various events, the kickoff was a big kickoff, but we were waiting to see, frankly, what a kind of a smaller kind of breakfast presentation would be. It hasn't dropped off, so I think we're seeing at least awareness and knowledge of this group and people showing up for the programming, which is very positive. And I think we're also seeing that legislators are looking to create action. At this last meeting, they were saying, okay, well, what are we going to do? So they're moving individually toward that action step, whether that comes through this Children's Caucus as a policy agenda. Again, that's not the initial goal, but perhaps it could evolve into that. But that momentum is building.
Yeah, I'll add to that. This is Linda. What happened was really exciting over the years in Colorado, especially the first couple of years. There, as I said, there was a big gap and a gap of knowledge, a lack of even interest. But over the first couple of years in particular, we ended up getting a lot more legislators involved, so much so, and it got so much attention that we ended up doing a whole children's agenda one year with the governor. Oh, actually 2 different years with the governor. One was 1.0 and the other was 2.0. But a whole package of bills that had to do with child protection. And those, I believe, would not have happened if it hadn't been for the Children's Caucus getting that attention.
Wow, that's great. Senator Newell, would you be able to share any examples of lessons learned or bumps in the road that you came upon developing the caucus that maybe other states could avoid?
Yes, I would definitely say food. Because attracting people to this, you'll attract the usuals at first, but to attract new people to it, and especially we have term limits here in Colorado as well, so we have the turnover, and so to attract new legislators to this policy, you need to attract them with food. I hate to say it, but we also chose to do it during session. That we have a larger state with rural areas. It's harder for people to get to the capital area in the interim, and so we decided to just do it during the session. That's great news, except for the bad news about that is it's during session, and you've got all of the other legislator priorities that they have during the session. So we have tried different times of day or a different day of the week. We chose a day of the week that would be most appropriate with the fewest amount of committee hearings and that kind of thing. We chose lunches on Mondays is how we ended up doing it. But so the over time, there are times if you get in the middle of Longville or something and one chamber is still on the floor, then you know you're just going to get one of the chambers to show up. But on the other hand, most of the time it works pretty well. The other thing I'd really heavily suggest is making sure you have an internal champion and an external champion, so that you have a legislator who's a champion, who's driven by it, who's passionate for it, and who will drive it through their leadership, but making sure that it's bipartisan leadership. And then the other is having an external champion, somebody like the Rocky Mountain Children's Law Center, where they can help you navigate the waters with the advocates and experts as well.
So this is Julie, and I have a follow-up, Senator Newell. You had mentioned leadership. I was just wondering, dynamics in each of the legislatures is different, but how involved was leadership? Were they informed? Can you just describe a little bit more about that?
Yeah, great question. Well, I would make sure I had a relationship with both parties, both chambers, both sets of leadership. So I would go in actually on a regular basis and let them know what the status was of it, what we needed from them. They kind of just, after a while, just left it up to me and said, whatever you say, go ahead, Senator Newell. It was just a joke around the Capitol that I was, the children's person. So pretty much they would give us anything that we needed, except for money and staff.
I feel like you answered the age-old question of what do lawmakers and college students have in common?
Yeah.
All right, so I'm not seeing any questions coming in. I think part of that is because you guys were so thorough, which is 95% you guys and probably 5% my prepping you. I'm just kidding. But I do have one other question. We'll take questions for a few more minutes. But in Wisconsin, I was aware of a most recent caucus event, and I heard you guys use the caucus not as an official platform, but maybe an unofficial platform for some action. Can you talk about that a little bit?
Sure. This is Representative Ballweg again. So one of the things that came forward from our work in the foster care task force was a real emphasis on home visiting. And one of the stakeholders had told us about that in Congress right now the appropriation is held up for the maternal, infant, early childhood home visiting program, commonly known as McVie. And this is something that the Children's Caucus had also been taking a look at and endorsing over the last couple of years. So at that meeting, as closing up, I suggested that the four co-chairs, not that we have a official way of asking the Children's Caucus to endorse or not a particular proposal, I asked the 4 co-chairs and announced to the general community who was there that we were going to be sending out a letter asking our congressional delegation to support reauthorization of the McVie program, and actually the Senate version, which does not require a certain amount of state participation, because Wisconsin, although we do invest in home visiting program, not to the degree that would be part of the authorization in the House proposal. So we do have this letter that we have are now collecting legislative signatures from our colleagues, and we'll be forwarding the Wisconsin case for reauthorizing the home visiting program, the McVie program.
Thank you, Representative. This is Senator Newell again. I wholeheartedly agree. We have done that too, although we do not take official votes in the caucus. What we have done is sent letters as the 4 co-chairs before to the governor, to the auditor, to certain entities where we knew something needed to be done and needed to be done fast.
Well, that's exactly what we're doing. We also do not take votes on the floor regarding these kinds of things, but it's not totally uncommon for members to circulate letters regarding a particular idea or issue and forward them to our congressional delegation, which we are in this case, and we're in the middle of it. It'll be sent off next week, but we've been getting pretty good support to this point.
Great, thank you. So we do have a question from our attendees. This question is from Delaware. Is there anything you do to come up with funding during tight budget years? And either one of you jump in.
Okay, I'll jump in. We have actually talked informally, because we're not allowed to take official votes according to our group, but we have individually worked on together budget amendments when it comes to the long bill. The only other dollars that we can gain access from are externally outside our state dollars, and so that's when we go out to the foundation community and work with them.
And I would say in Wisconsin, to go back to what Senator Newell said, in getting people to come in to the meetings, food, and that is one of the things that the Child Abuse and Neglect Prevention Board supplies, as they have put us and support for the Children's Caucus in their budget. So that gives them some administrative time and some of not a lot of dollars, but enough to get people to come for coffee and donuts for a meeting, or some salads at a lunch. So that's been helpful, but because we're not taking positions on individual items, I think you just see much more support for individual legislative initiatives that some of the co-chairs and some of the folks that are more interested and learning about the Children's Caucus, I think you see more co-sponsorship and support in the budgeting process. And we have been moving forward in support for some of these issues. I would say not nearly enough, but we are making some inroads in support for these kinds of programs.
We have just a couple of minutes left. I think enough time for one question. I know we have 3 there. I think I can kind of answer the 2. Looks like there's a question about how advocates leverage the caucus to push policies. I think we heard from both Wisconsin and Colorado that they're very actively working to just educate, so they don't see themselves pushing policies in general. And the follow-up question to that is if you foresee it being difficult. I think what we heard our presenters say is that they believe by establishing a really firm foundation of being legitimate educators, they could build upon that, but that's not what they're working on currently. So we'll go to Robin's question. Is there any process by which the recommendations are vetted, including a search of the empirical literature for solid evidence?
Yes, I can speak to that. The Becky Miller Updike Dr. Becky Miller Updike from Rocky Mountain Children's Law Center is actually one of the she used to be the Child Protection Ombudsman, so she's one of the state's leading experts on both EC and child welfare. She and I only will have experts in either national or state experts with evidential data to present for the caucus, because we don't believe in having. We want to make sure that we're doing everything on the up and up, so to speak, when it comes to data.
And I would lean on Michele to talk about how we lean on their organization to provide some of that programming. Michele?
Yeah, so a couple of different ways that we address this issue. The first is we have an interagency agreement with the University of Wisconsin-Madison School of Social Work and Institute for Research on Poverty. And so we utilize their expertise frequently in terms of, checking in on presenters. We typically will have them do a literature review on a particular topic if necessary. And so we're very fortunate to have that relationship where we can tap into their expertise. And then when it came to identifying stakeholders across the state, individuals who are doing family support work, we did attempt to really have them highlight what is evidence-informed or evidence-based in their practice. So with parent education programs, we really did want to highlight those programs that were being implemented with fidelity and that we could verify that based on the monitoring, at least that our organization had done. As we move into other topic areas that perhaps aren't as closely related to the work of the Child Abuse and Neglect Prevention Board, we will still do that vetting, though, that any information that would go before the Children's Caucus through the process that I briefly described, where they provide an abstract, provide a description of what they're going to present, we would do that kind of background inquiry to make sure, again, that it's got some basis, although we still want to leave some room, obviously, that if there are new and innovative approaches that haven't been tested yet, that we're still considering that in our discussions, and we'll determine the criteria for that with leadership of the caucus in terms of what information is presented. But our baseline is it has to be evidence-informed, research-based, and a fair amount of investigation before that information is put forward.
Wonderful. Thank you so much, Representative Ballweg, Michele, and Senator Newell for providing such helpful information today. I think this will have to do our wrap-up now. So an archived version of this webinar will be available shortly on NCSL's website, and I'll send an email once the archived version is available. We invite you to sign up and join us on November 30th for a webinar on home visiting. I'd also like to note that this will be an issue NCSL continues to follow. You can look for a designated Children's Caucus website and a magazine article in the near future. And if you have any questions on Children's Caucuses or other issues, please don't hesitate to reach out to myself or any of the staff listed here. In addition to any questions, if your state has a Children's Caucus that was not covered in today's webinar, specifically the slide at the beginning, please let us know. I'd also like to highlight our upcoming meeting being held next month. NCSL will be hosting our annual Capitol Forum December 10th through the 13th in beautiful Coronado, California. It's not a bad place to spend a couple of days with your legislative colleagues in the middle of December. If you've not already signed up, I encourage you to do so by following the link on the screen. This meeting will give you a chance to explore state policy issues from coast to coast. The Capitol Forum is where legislators and staff learn the latest on pressing issues and develop the agenda that guides NCSL's advocacy work on Capitol Hill. Connect with colleagues from around the country while exploring beautiful San Diego. The forum includes sessions that may be of interest to legislators working on children and families issues. These include sessions on two-generation strategies, foster care, and discussing the healthy development and well-being of infants and toddlers. And finally, we ask that you complete the evaluation, which will pop up on your computer screen at the conclusion of this webinar. The survey link will also be shared electronically with you. Please take a few moments to complete the evaluation survey. We take your feedback seriously and would love to hear your thoughts. Remember that NCSL is here for you, and if you have any questions or comments, please feel free to email or call. Thank you again for joining us, and we hope to see you on the next webinar at the end of November. Have a great rest of the day.